Hello dear friends, welcome back. We are discussing about the muscular system, and that series of lecture we have started about the muscles of the upper limb. So in our previous lecture, all these were our lectures. We discussed about the muscles of the pectoral region, muscles of back, and muscles of shoulder, and muscles of arm region. Now we are going to discuss about the muscles of forearm. So our today's lecture we are starting new series, that is muscles of forearm, or it's also known as antebrachium, right? So some important points about forearm, that the forearm is a region of the body spanning from the elbow to the wrist, right? Forearm is the part of the upper limb which is from your elbow up to your wrist joint, right? And it consists of several muscles and an extensive neuromuscular network encased in three compartments. Okay, and these include the anterior compartment, the posterior compartment, and the mobile web, which we will discuss. The anterior compartment muscles are called the flexor compartment, and all these muscles are responsible for the flexion of your hand. And the posterior compartment muscles are called the extensor compartment, and they are responsible for the extension of your hand, right? The compartment of forearm are separated by interosseous membrane found between the radius and ulna, in addition lateral intramuscular septum also. So here you can see this is your radius bone and this is ulna bone, and between the radius and ulna there is a compartment, there is an interosseous membrane which is called the intraosseous membrane, right? And it's a connective tissue membrane, and anterior to this membrane is called the anterior compartment, and posterior to this membrane is called the posterior compartment muscles, right? Now we said that the compartments of forearm include the flexor compartment, which is called the anterior compartment. Now why they are called flexor compartment? Because whenever these muscles contract, the anterior compartment muscles contract, we have taken here a section of horizontal section of the forearm, right? So when these anterior compartment muscles will contract, they will pull your hand upward, so we say the flexion of the hand. And when these muscles contract, the posterior compartment muscles contract, what do? They bring back the hand to its original position. That movement is called the extension movement. So that's why the posterior compartment muscles are called the extensors. Now, muscles of anterior compartment of forearm. First we will discuss about muscles of anterior compartment, then we will discuss about muscles of posterior compartment, and then we will also discuss mobile web of it, right? So the muscles of anterior compartment of forearm, the anterior compartment of forearm is divided into superficial and deep muscles. Again I will say, the muscles of anterior compartment of forearm are subdivided into superficial layer and deep layer. Superficial muscles are towards the skin, deep layers are away from the skin, right? So first we will discuss about superficial muscles of anterior compartment of forearm. The first muscle, Flexor Carpi Radialis. Flexure means it will cause flexion, Carpi means carpal bones, Radialis means on the radius bone. So now you can see this is your Flexor Carpi Radialis muscle, right? This muscle, when it contracts, it causes the flexion of carpal bones, right? And it comes towards the radius, that's why we call it radialis muscle. This is ulnaris because it is towards the ulna, and this is called radialis, flexure carpi radialis. Whenever this muscle contracts, it causes the flexion of these carpal bones, that's why we call it flexure carpi radialis, flexure carpi. And why it is called radialis? Because it comes towards the radius, that's why we call it radialis, right? So it's a muscle of forearm. The shape of the flexor carpi radialis muscle is fusiform, right? You can see it's a little bit fusiform. And its location, the flexor carpi radialis muscle is located in the anterior aspects of the forearm. That's why we say that this muscle is the muscle of the anterior compartment, of the forearm, which belongs to the superficial muscles, right? What is its origin? It originates from the medial condyle of the humerus. You can see here, this is the medial condyle of the humerus and this is the lateral condyle of the humerus. So it takes its origin from the medial condyle of the humerus, right? And it inserts into the base of the metacarpal bones 2 and 3. Now you can see here it inserts into the base of the metacarpal 2 and 3, right? What is its action? At the wrist joint, it causes the wrist flexion and wrist abduction, right? So whenever this muscle contracts, what will happen? Your hand will come up, right? So we call it flexion, and whenever it contracts, your hand will go a little bit away from the center of the body. That's why we call it abduction. And what is the blood supply? The anterior, posterior, recurrent ulnar artery and radial artery. Anterior, posterior, recurrent ulnar arteries and radial artery. Here this muscle takes its blood supply. And what is its innervation? It is innervated by median nerve, right? This is the median nerve and it gives innervation to the flexor carpi radialis muscle, right? Okay. The next muscle we will discuss in the next lecture, that is pronator teres, and then we will also discuss the other superficial muscles. So be with us, friends. If you like our lectures, please do comment and please share this the link of our channel with your friends also. Till then, friends, Allah Hafiz.